Hello friends, this is your friendly neighborhood pediatrician Dr. Aditya Bhatt, and the answer to today's question is the image is of a sign known as Rosu's sign. As you all might know, it is a sign for hypocalcemia, and it is the presence of carpopedal spasm after which is usually elicited after elevating the systolic blood pressure more than 20 after 3 to 5 minutes, and you can see the carpopedal spasm. There is another sign known as Vostek sign or Chvostek sign, which is hyperexcitability of the facial muscles. Now, I would like to tell you basics about calcium metabolism. So usually in fetal life, the calcium metabolism is regulated mainly by PTHRP and not parathyroid hormone. It has a minor role. The major role is played by PTHRP, and during neonatal period, we call in a preterm child if the calcium is less than 7 milligram per deciliter, it is called as hypocalcemia, and in term babies it is usually less than 8 milligram per deciliter. Some books vary by 7 and 7.5, but this is general rule that less than 7 in preterm and more less than 8 in term. Now there is another thing called as ionized calcium, which is actually calcium is found in two forms. One is unionized and one is ionized. The unionized is bound to albumin, and the ionized is the active form, free form, which does all the physiological roles of calcium. So ionized calcium is usually 50% of the total calcium, while the unionized calcium is other 50. Now sometimes ionized calcium is asked with the units of millimole per deciliter. So when you take millimole per deciliter and multiply it by 4, you will get the value in milligram per deciliter. For example, if you get a calcium value as 1 millimole per deciliter, then if you want to convert it in mg per deciliter, you have to multiply by 4. It is a rough idea for you to get helped in exams. You do not have time to calculate, so this is just a rough idea. Now usually hypocalcemia in newborn occur. The causes of hypocalcemia in newborn are actually hypocalcemia in newborn are of two types: early onset and late onset. Early onset is usually within 72 hours, and late onset is after 72 hours, same as neonatal sepsis. So early onset hypocalcemia, the causes are IUGR, preterm, child of diabetic mother, and perinatal asphyxia. While the causes of late onset hypocalcemia that you have to remember are mainly two. There are multiple like Burkitt syndrome and Sanjay Sakati and others, but the two main causes you have to remember are: one is vitamin D deficiency. Usually the mothers who have vitamin D deficiency, it is manifested in their children in neonatal period. And the other cause of refractory hypocalcemia is DiGeorge syndrome. You all know the DiGeorge syndrome. It is 22q11, and it manifests with chorotruncal deformities and thymicroplasia along with refractory hypocalcemia. Thank you for listening, and in case you have any doubts, please ask me. Get through me through my Instagram and Telegram handle. Thank you.